This is an initiative that started in 2008, and it's performed in collaboration with the Fundació Dr. Robert in Barcelona. The EURORDIS Summer School is a 4-day program that's held in Barcelona every year, normally in June, where we invite rare disease patient advocates to come and learn about clinical trials, drug development, and the European regulatory processes. We've been lucky to have an excellent staff since the beginning, and these people represent consultants, members of the EMA, as well as academics, and also members of the scientific committees at the European Medicines Agency. The course is not rare disease specific. We do not focus on any particular disease nor any particular country issues, but I think the empowerment that patients receive during this time can help them then to go on and act on behalf of their disease in their own country at their national level. It's a very intense week with lots of courses over the 4 days, but I think it is very rewarding for all the people that have attended so far. As important as the learning objectives, I think, are the networking opportunities that people have, and also their opportunities to really connect and share their experiences.
I'm Nick Cicero from the AKU Society. We're a patient group working on AKU, which is a very rare metabolic disease, and I'm here in Barcelona at the EURORDIS Summer School on clinical trials for rare diseases for patient group advocates. And it's been a terrific few days because we've learnt a whole bunch of things, such as the regulatory process, such as the statistics behind clinical trials, how to build a clinical trial, all these different areas which will help us as a patient group as we interact with industry and with the regulator to find cures for our patients, because we're working on a very rare disease for which there is no cure.
I'm from the Portuguese Congenital Defects of Glycosylation Association, which is a non-profit organization. And besides the work that I'm doing in the organization, I'm as well a basic researcher. And for me, as a basic researcher, it was very important to have the EURORDIS Summer School training, because it gave me a lot of knowledge related to all the process that we have to do to have the drug in the market. And I could also learn that that basic researchers are very far away from all these steps, and maybe it would be very useful to know more about, for example, the orphan drug designation, and it would be very useful to basic researchers to apply it for this designation, because there are many works that can be applied for the orphan drug designation.
Hey, I'm Erik Costa. I'm from the Netherlands, and I was here to lecture at the EURORDIS Summer School about the ethical aspects of medical research on human subjects, which is a very important issue when it comes to thinking about clinical trials, because we ask people to participate and we do all sorts of things with them, and we should do that knowing that we really get good results that help us forward in research of rare diseases. And well, apart from lecturing, I'm part of the group too. I'd like to intermingle with all the participants, and what strikes me most every year I am here is how motivated people are to come here and to learn, but above all to share experiences, because they are all involved themselves. They are ill, or they have relatives or loved ones who are ill, and they come here and they are here to strengthen each other, not only to learn but also to network and to find ways to tell companies and authorities that it's really very, very necessary that we make progress in the field of rare diseases research. So I enjoyed it very much again this year, and I hope to be here many, many times more.
Hi, my name's Rob Platika, and I'm the Online Patient Communities Coordinator at EURORDIS. And I was one of a few EURORDIS staff members who was lucky enough to attend the summer school in Barcelona as a participant. And I learned quite a bit about the role of patients and patient organizations as advisors to the EMA in the different committees, which is a great thing that I can look out for in my work for those patients and patient groups that might want to help to offer their expertise at the EMA.
Hi, I'm Carol. I'm from the Myasthenia Gravis Association in the UK. And when I came to EURORDIS Summer School, I had a little bit of information about my my own place in rare diseases and my own rare disease. But now, since I've been here, I can see in the kind of bigger context of rare diseases and where I fit in the, not just the bigger national picture, but the bigger European picture. And the EURORDIS Summer School has given me so much more information and so many more questions. And the value, I can't say the value of meeting other people and finding the similarities and the differences and the challenges faced by not just rare diseases, but by orphan drug development. And so for me, the clinical trials information and understanding how that process works and how as patients we might actually be able to have some input into that has been superb. It's been really hard work, but it's also been really good fun, and I'm delighted that I came. Thanks, EURORDIS.